Next question is, what's the treatment for recurrent low-grade serous carcinoma? Well, there are several options. Secondary surgery may be recommended. Systemic therapies, chemotherapy, endocrine therapy, targeted therapies, I'll talk briefly about. Immunotherapy, let me say a couple things about immunotherapy. All of the molecular profiles of women with low-grade serous carcinoma suggest that immunotherapy is not going to be very helpful. In ovarian cancer in general, it's been very disappointing, although there are some patients who do benefit from it. But in low-grade serous carcinoma, I would say we don't have enough experience yet, but it doesn't really look like, at least the current immunotherapies, immune checkpoint inhibitors are going to be effective. That doesn't mean that other newer immunotherapies may not be effective. Rarely we use radiotherapy in very selective patients, maybe to spot treat a lymph node enlargement or a bone involvement or something like that, but very sparingly. But we also know that for treatment of recurrence, there's no standard sequencing of these various systemic treatments. We try to explain what the treatment options are, compare the risks and benefits of all the drugs, and all of these drugs, of course, have side effects, and have the patient make the best decision she can with physician guidance. Of course, clinical trials are always encouraged, but some patients, as I already mentioned, don't like to participate, particularly if it's a randomized clinical trial. Secondary surgery is applicable for some women who have a recurrence, particularly their first recurrence, but there's no prospective data. It's all retrospective data. The one on the left is from our group at MD Anderson. And we know if a woman undergoes secondary surgery and you're able to remove all of the disease you can see or feel, they're going to do better than if you can't remove it. But the selectivity of recommending secondary surgery is really for women who have maybe one or at the most 2 or 3 sites. It's not really generally recommended for like carcinomatosis with multiple small implants spread throughout the abdomen. These are the chemotherapy and endocrine therapy drugs that we have available for the treatment of recurrent low-grade serous carcinoma. I'm sure many of you have had some or a lot of these drugs. I mentioned about the CDK4/6 inhibitor. Again, it's FDA approved for breast cancer, but not for ovarian cancer right now, although that will change in the future. But they're very hard to get. Most insurance plans will not approve them, although some do, combining them with one of the endocrine therapy options.